Medicaid gap. A gap that no one should be in, a gap that needs to be closed. When I lost my job in 2013, I applied for a private plan but was denied coverage for my medical conditions, pre-existing medical conditions. In 2014, when the marketplace kicked in, I applied for the private plan. They didn't turn me away, but I was deemed ineligible for tax credits because I earned under the poverty level. Because I couldn't afford to pay full price for a private plan, I turned to Medicaid. Ultimately ended in rejection. First it was I made too much money. Now they say I need to apply for disability. That's what I need to do to get coverage. But I don't want to be disabled. I'm 37. I want to go back to work. I want Medicaid. I tried to work off and on over the past couple of months so that I could try and purchase coverage, but my back is so bad to the point that last week I couldn't even rake the leaves in my yard. Again, I want to go back to work, but in order to do that I need health insurance.
I'm a doctor, and I work at the Family Care Health Centers in St. Louis. The patients who fall in a coverage gap are working their bodies so hard that they're coming to me with musculoskeletal complaints and issues that are directly related to the fact that they are waiting tables, driving a shuttle bus and carrying really heavy luggage all day long, catering, house cleaning. The list goes on and on. Most of my patients who don't have insurance work, and they don't have the insurance to keep them healthy enough to work, and sadly it's actually the work that is wearing down their bodies, so they need it even more. I think there's a misconception that Medicaid perpetuates poverty and welfare, but what I've witnessed in the clinic is that sickness perpetuates poverty and welfare. I wish our policy. I have been at the same health center for 13 years, and I continue to be baffled at the incredibly sad stories of patients who are suffering but trying so hard to persevere. I wish they understood that.
My name is Joanna Strong, and I am from Springfield, Missouri. I am 55 years old, and I'm considered totally and permanently disabled. In February of 1999, I went to my local hospital because I had been having severe migraines and feeling extremely ill. I was diagnosed with a serious case of meningitis and immediately began seeing a neurologist. At the time I was diagnosed, I was a small business owner with my own window cleaning company. I was uninsured because I wasn't making enough to pay for insurance. All of this has led to my inability to work, which would have been time that I could have been paying taxes back into the government. I believe not offering Medicaid to people robs the state of its own economic growth. There's no telling what I might have been if I would have been able to get the medical care that I needed. I fully believe with all my heart and soul that if I had been given the opportunity to have Medicaid benefits earlier, I would not be physically disabled and would be far better off than I am today.
Today, I'm here to tell you the story of one of these people, Linda Palmer, who is doing her best to make ends meet, but even as such, still does not have access to affordable health care. At age 61, unfortunately, Linda was laid off from her full-time job. She has been looking for work since then and doing substitute teaching, but hasn't been able to find a full-time position. After a year, she began drawing her early retirement, but she is still below the poverty line. As she says, "It's very scary for me to not have any health insurance. I'm healthy, but at my age, you never know what's going to happen." Linda is proactive about her health. She paid for a flu shot, and she sought help from a navigator at a hospital in the hopes of getting affordable insurance. But the best she could find was that the hospital agreed to list her as a charity patient, so 80 to 90% of her bill would be covered by the hospital if an emergency were to happen. "I've never not had health insurance before," Linda says. "I never would have expected this to happen." Linda is optimistic. She's smart and a very hard worker, and she's in the Medicaid gap. I'm asking you to think of Linda and others like her and extend Medicaid coverage to all those below the federal poverty line. Thank you.